Okay, so welcome to today's webinar, today's talk. I want to talk to you today about Rhus Tox family. And isn't it a very common family and a very common remedy in our practice? From today's webinar, we'll try to understand how, if we understand Rhus Tox well, how we can use other remedies from the same family, which we don't use so often, more in daily practice. We'll try to do that. But for that, first we'll have to understand the main genius of Rhus Tox. Let's try to understand. The main genius of Rhus Tox, if you read from Allen's keynote, is pain as if sprained, as if muscle tendons were torn from its attachment, as if a kind of stiffness and pain on first moving or on getting up in morning. You read from Clark, ABC, Materia Medica, you can see the main keynote of Rhus Tox being stiffness and lameness. You read from Clark Dictionary, Practical Materia Medica, again you see bruise, sprain, and stiffness as the keynote. Interesting. So, which are the remedies in this family? Let's try to understand that. Anacardium orientale, Anacardium occidentalis, Comocladia, Magnifera, mango that is, Rhus aromaticus, Rhus divorciloba, Rhus glabra, Rhus tox, Rhus radicans, Rhus venata. And if we use software, Mac Repertory, which I believe is the best software in the world, and try to see what is common symptoms in all this remedy, you'll see the common symptoms of, let's see, this is from the rubrics: extremities cramp in lower limbs, foot back, anacardium rus venata, comocladia dentata. Number two, extremities lameness, upper limbs, upper arms. Next, generalities, bathing, washing, amerate. Again, anacardium Rhus Tox rus venata. So this kind of stiffness, cramps, and better by washing seems to be a kind of keynote, genius of this family. And what is cramp? Cramp is a kind of stiff, kind of an involuntary spasm. This spasm is the key feature of this family. Even in anacardium, if you study anacardium, you'll see main thing that comes through is a kind of a plug, constriction, pressure. Interesting. Plug is also a kind of tightening, isn't it? Even if you read Comocladia, the main genius is crampiness. And Rhus Tox, we know the main thing is tightness and stiffness. So if you study it in detail, the main genius is stiff, tight, tension, cramp, stuck. The main thing patient says, I feel stuck. I feel stuck, doctor. I feel stuck. And the active reaction, what makes them feel better is getting out of the house, walking, continued motion. So that's why they will always be in the motion. So main thing is stiffness, spasm, better by movement. So if you study this a little bit more, the main experience of this family is a kind of as if something from outside holds tight and they feel stiff, tension, stuck. They often use the word I feel trapped. I feel trapped in my body. And they feel better by movement, doing something constantly. This is a little different to Cactaceae, that is a cactus family. Cactus has a lot of constriction and expansion. Cruciferaceae, which is more like an obstruction. Euphorbiaceae, which is bound and unbound. Primulaceae, which is like a paralysis from inside. Let's differentiate. There's another family that is from Rhus family, that's Crataegus family, and the main sensation is sudden pressure inwards. Euphorbiaceae, the main experience is tide. Cruciferacy, the main sensation is obstruction. Let's try to study some other remedies from this family which I want to tell you. Rhus glabra, this is the main remedy is aphthous. If you see a case who has a lot of aphtha in mouth, think of Rhus glabra. Lot of ulceration in mouth, Rhus glabra, remember. Comocladia dentata, main remedy for glaucoma, remember. Also for skin issues like eczema on the trunk. Another case, a remedy you should know, Rhus radicans. This is a remarkable remedy for worse kind of itching aggravated by touch, worse kind of scleroderma, dermatitis exfoliata. even urticaria, almost like Rhus Tox. Rus venata, this has skin symptom worse than Rhus Tox, remember, better by warm bath. Mangifera, especially itching in the palms, but main remedy for cervical spondylosis. Also for urine, kind of upper respiratory tract infection. So these are some thoughts I wanted to give you tonight. And well, this is my contact. You can write to me what you feel about my talk. And you can, if you want me to consult for any case, I can do a Skype. This is my Skype ID, and this is my homeopathic channel.